It was pretty severe, we were told that from day one. It was a lot of damage to the spinal cord. Yeah, in my eyes it was a pretty small accident. It's obviously just the way I landed, which I don't remember. They say I must have held onto the bars and gone over and stabbed my back backwards like a scorpion. Laying on the ground by myself, sort of head planted in the dirt, and my kids run to me and, "Daddy, get up, and yeah, nothing would move." They called the helicopter straight away. Took about an hour to stabilise me on track, and then I got airlifted directly to PA. I can remember the spinal surgeon saying, "You're paralysed for life, do you understand?" And I just said, yeah, but I really didn't understand.
All motor command that comes down from the brain to our muscles will go through the spinal cord. All things that we feel and perceive with our bodies, they will travel up through the spinal cord to the brain, but also many things that we don't often think about. So things like bladder and bowel function, sexual function, all of that is controlled in a way through pathways that descend through the spinal cord. So when the spinal cord gets injured, effectively we are disrupting or severing a lot, it's sometimes all of these pathways, and so as a result of that there is a huge range of problems that people with spinal cord injury have to deal with.
I realised that you're wheelchair bound, but I didn't realise everything else that comes with it. Bowel, bladder and two of the big ones. Yeah, they're two things that I guess everyone takes for granted, and it's a big change when you lose them.
As you can see here that obviously the spinal cord itself, which is the neural tissue, is surrounded by the bones of the vertebral column. And when these bones break, there is a compression of the spinal cord, so the nervous tissue, that then causes disruption of pathways, loss of nerve cells, etc. And that then leads to the symptoms, for example, of paralysis that we typically see after spinal cord injury.
So the rehabilitation process is fairly prolonged, and preparing the patient to live outside the hospital is a challenge because they might need changes to their living accommodation, home modifications. It needs the assistance of a large multidisciplinary team comprising of doctors, nurses, physiotherapists, occupational therapists, social workers, psychologists, dietitians, trying to gain as much or teach them as much independence given their limitations from what they've lost.
Finally getting home after 4 months was like heaven coming out of PA, and then to sort of sign up and start intensive physio, but yeah, it's the best thing I've done.
We are looking at new ways to minimize the damage. We know that most of the damage happens at the time of injury, when Michael actually fell and hurt his back. There's also a lot of damage which occurs following the injury. A lot of inflammation or swelling occurs around the nerves and the spinal cord. And a lot of new research is targeting that inflammation or the secondary process which happens just after the injury. So what we are embarking on is a study where an experimental drug is injected to the patient within 12 hours of injury, thereby trying to reduce the secondary damage or swelling.
We know that there is at least aspects of the inflammatory response following a spinal cord injury that will cause further damage to the spinal cords. And of course, the more neural tissue that we lose, the worse the prospects are for recovery in terms of outcomes. What our research has consistently shown, that if we target specific aspects of that inflammatory response, that we can actually improve outcomes, for example, in terms of function that returns following such an accident. Michael was one of the recipients of this treatment, and that was because he came to the hospital very quickly. And so because one of the critical things at the moment is that we need to start administering this treatment within 12 hours of the accident. So what we are doing is running a clinical trial. It's a high dose of immunoglobulins that are collected in a way from the plasma of healthy blood donors. And we know that when you give somebody these high dose of immunoglobulins, that they have a very potent immunomodulatory anti-inflammatory effect. There are some very early, I would say, some encouraging data from the bloods that inflammation may be reduced overall as a result of this treatment.
Until recently, we'd seen general increases in his fitness and his core strength, but in the last 2 to 3 weeks, we've actually seen some small improvements in his lower limbs. With upper body support, he's actually able to produce a hip flexion so he can step forward. When they're going through the acute rehab together and dealing with a pretty heavy injury, they form close bonds, and you definitely sense the camaraderie. And that transfers across, and a lot of them hang out on weekends, and we hang out on weekends with them and have lots of social outings.
Nothing's easy, from getting out of bed to showering to rolling in bed in the middle of the night. Everything's different, but yeah, can adapt to it.
We still try and do as much as possible that we normally did to keep life normal. It's just a bit of planning before we go away or do anything, or getting used to, if you're going for a restaurant, checking that they have access before you go. And just that kind of thing where you learn out in public.
Spinal cord injury is such a devastating thing to happen to someone, and we hope to really profoundly affect outcomes and improve recovery of these individuals.
We want to see as much recovery as possible. There's no magic bullet as yet for that to happen, but we are hopeful that any new trial, even if it makes a slight difference in improvement in recovery with the ability to move their legs or arms or hands or bowel bladder function, will be a bonus. So we're hopeful that anything new will change things and give a better quality of life for patients.
What we need at the end of this trial, which is looking very promising so far, is to engage in a much larger, which will be a multi-center trial, to really get sufficient numbers so that we can make scientifically sound conclusions that this treatment is actually, really working the way that we think it is, and improving outcomes for individuals affected by it.
I'd like to think I have made improvement from it, hoping other people get improvement, and hopefully the research can keep going ahead, whether it's into that drug or other drugs. Short term is hopefully get as much progression or improvement as I can in below the injury. Long term, fingers crossed for a cure. That's why I keep going to rehab, just to keep fit and be optimal fitness should something arise. Yeah, I'm hoping in the next 5-10 years something's there. I want to get back up. Yeah. I want to dive back in the beach. Yeah. The things you miss.